afternoon and a warm welcome to our audience. I'm Dr. Madhusmita from 2050 Healthcare. Asthma remains a prevalent respiratory condition affecting individuals of all ages, characterized by airway inflammation and hypersensitivity. Today, on Asthma Day, we aim to delve into the intricacies of asthma, exploring its impact on lung health, symptoms, diagnosis, treatment, and lifestyle management. Join us as we navigate through this important topic to raise awareness and promote better health understanding of asthma care and management. Joining us in this discussion is Dr. Kavya B.N, a seasoned senior physician from our esteemed 2050 healthcare team. With over a decade of experience in healthcare environments, including hospitals, clinical settings, primary care, and teleconsultation services, Dr. Kavya brings a wealth of knowledge and expertise in managing a spectrum of metabolic disorders. We are eager to benefit from Dr. Kavya's insights as we delve into the critical intersection of asthma and metabolic disorders in our discussion ahead. Welcome, ma'am. The first question for you, ma'am, is what is asthma and how does it affect the lung? Is it an inflammatory or a fibrotic disease?
Asthma is a lung disorder which causes bronchospasm, inflammation of the airways, as well as blockage of the airways because of the increased mucus production. So when we say bronchospasm, it means tightening of the muscles around the windpipe. Inflammation means the inner lining of the windpipe becomes thickened, and mucus production is when the mucus or the secretions produced within the airways are going to be blocking the airways, causing difficulty to breathe. So this is asthma. Is asthma an inflammatory disorder? Yes, definitely it is an inflammatory disorder. But does it start off as a fibrotic disorder? No. When repeated inflammation is there, what happens? The lung tissues do get damaged. So if asthma is not well controlled and there is repeated inflammation, then it finally ends up being a fibrotic disease.
Thank you, ma'am. Moving on to the next question. What do you feel are the common triggers for asthma attacks?
The common triggers for asthma include air pollution, dust mites, your exercise, mold, pests, pets. The dead cells, dead skin cells of the pets can also cause allergies, tobacco smoke, then strong smells of any chemicals like the floor cleaners or acids, and certain occupational exposures.
Thank you so much, ma'am, for answering that question. The next question is what are the typical symptoms of asthma and how can they be effectively managed for good quality of life?
Typical symptoms of asthma include the cough, especially the night cough, wheezing, the whistling sound that you hear as and when you breathe in and breathe out, then shortness of breath, where even doing a small activity is going to lead to breathlessness or being out of breath. And the next is the chest pain or the tightness of chest is also a very, very common symptom of asthma. How do we control it? So we can control it in two ways. One is preventing. Preventing an asthma attack itself becomes very, very important. The second part of it will be the treatment of an ongoing asthma. How do we prevent? We can prevent asthma by having a very good lifestyle, which includes having a good balanced diet with plenty of antioxidants in it, which can be got through, fresh fruits and vegetables. Next is having a good 7 to 8 hours of sleep, leading a stress-free life, making sure, you avoid to smoke and, drink alcohol. Next will be your avoiding asthma triggers per se, right? And how do we manage it? Like I told you, asthma is a component of bronchospasm, inflammation, as well as mucus production. So our treatment will be aimed at reducing the bronchospasm, that is widening of the airways. Second is to reduce the inflammation. We give anti-inflammatories to reduce it. And the third will be to decrease the secretions or the mucus production. That is how we will be managing. We will be giving medications to manage those symptoms.
Thank you, ma'am, for answering that question. The next question is how is asthma diagnosed and what tests may be involved?
Asthma is usually diagnosed when we take a complete history of the patients. So, genetics also plays a very, very prominent role in asthma. So, if a strong family history of father and sibling or mother having asthma is there, then most probably, yes, there will be asthma even in the person. Next is also taking previous histories, whether they had history of having breathlessness, unable to complete a task, the whistling sound. So the history itself, we will be able to evaluate. But to confirm the diagnosis, we will be doing what is called as the pulmonary function test or the lung function test, where you will be breathing into a machine to see what is the capacity of your lungs, how well your lungs can function. So that gives us a very good idea as to whether you have asthma. Next is the chest X-ray. So the chest X-ray helps us in diagnosing asthma. Next, to confirm the causes for asthma, we will be doing allergy tests. That can be either a skin test to, a n number of allergens that can be present, or we can also do a simple blood test, which can help us detect the IgE levels. So IgE levels are produced in response to any allergens. So, even identifying that IgE levels are high helps us in diagnosing whether a patient has asthma.
As we have got a basic understanding of what asthma is, if you can also let us know what are the different types of asthma and how do they differ in terms of symptoms and treatment?
Asthma can be classified in a number of ways, the most common being the pediatric onset of asthma or the adult onset of asthma. So, asthma starting at an age much before 5 years is called as the pediatric onset of asthma, whereas adult onset of asthma is any asthma that comes first time in life after the age of 18 years. The next common type we try to differentiate asthma is the allergic or the non-allergic kind of asthma. Allergic asthma is the one where the body produces allergies in response to various external factors, right? Like like I told you, the dust, the molds, the pet danders, or the pollens, or the pollution, or the secondhand smoke, or the smoking itself. So anything that is the asthma that is coming out of a response to an allergen is called as the allergic asthma. Whereas the non-allergic asthma is the one where you get asthma in relation to changes in the temperature, changes in weather, because of stress, because of exercise. That is called as the non-allergic version of asthma. So these are the two most common types how we differentiate what an asthma is. Management of these asthma remains the same. The only difference being if it is an allergic asthma, we know we will be concentrating more on anti-allergics prevention of asthma by preventing our exposure to the allergens. Otherwise, the treatment or the modality of treatment remains the same.
Thank you, ma'am. Moving on. It is often opined by experts that chronic seasonal allergies, if not managed well, can ultimately lead to asthma. How far is this true and why?
It is correct. Like I told you, the allergic asthmas. So the asthma which occurs because of allergies is one where, the moment you are allergic, if you know that you're allergic to, dust mites, or if you're allergic to pollens, making sure that, you are avoiding these triggers, or avoiding, going for a run when the pollen count is very high in the environment, or, stepping out, when the air quality index is very poor, can be avoided. But once we do not take measures to protect ourselves from these allergens, the asthma, it becomes as a trigger for asthma, and the number of episodes of asthma or the flare-ups of asthma will be very, very high. So once that happens, then it starts causing permanent damage to the lungs. So if we should know, asthma is a reversible condition. So where, the moment you give them good treatment, our lungs go back to the normal state. But when there is a repeated infection, what happens is that, the control of asthma becomes very, very poor, and there can be permanent damage to the lungs.
Thank you, ma'am, for the insightful answer. The next question is: are there any long term effects of asthma and how can they be prevented or minimized?
Are there long terms? No. If an asthma is well controlled, so what is called as an asthma control? If a patient is able to do all the activities that he intends to do without having any of the symptoms like shortness of breath or cough or chest tightness, that means he has a good control of asthma. He will not be requiring rescue dose of inhaler at all, right? And he will be able to carry out all his exercises and the required thing. So once a patient is able to have a good asthma control, then yes, asthma is can be prevented. Is asthma a curable disease? No, it is not a curable disease, but is it a disease that can be prevented and well controlled? Yes, definitely it's a disease that can be well controlled. So how do we go about it? You need to make sure that you need to avoid the triggers for asthma. You also need to make sure that you follow up with your doctor as advised based on what's the severity of asthma. That is how you follow up with your doctor. So make sure you follow up and always have an asthma action plan where what is the kind of medication that you need to take. So if you follow that, then you will have a very good control of asthma and you can lead a normal life as close to normal life as possible.
Thank you so much, ma'am. The next question, can asthma affect sleep quality? And is there a link between asthma and obstructive sleep apnea?
Asthma, when it is poorly controlled, so the symptoms will remain, be it day or night, right? But the second thing is, when going to sleep, there can be, there can be some dust molds or pollens or things that can be on the bed, which can trigger an asthma attack in the night. So that should be avoided. And the third thing is the sleeping position. So whenever a person sleeps, when we lay down flat on our back, the tongue usually falls back, obstructing the windpipe, or the night narrows down the airway entry. So then there will be worsening of asthma symptoms. So these are the few things that needs to be taken care whenever we discuss about asthma during the night times. Second is obstructive sleep apnea, a kind of asthma? No, because asthma involves the windpipe and the lower respiratory tract, right? It involves the bronchus, the bronchioles, and the air sacs. Whereas obstructive sleep apnea has much to do with the upper respiratory tract, very, above your pharynx and larynx. So is obstructive sleep apnea an asthma? No, it is not.
Thank you so much, ma'am. I think we have spoken about what asthma is and what are the signs and symptoms associated with it. Moving on to how can we manage asthma? The first question in this is, what role does inhaler technique play in asthma management and how can it be optimized?
So inhalers, it helps both in, preventing bronchospasm as well as reducing the inflammation. So they are available as a, the inhalers. So rescue inhalers are available as well as control inhalers are available. Rescue inhalers are the inhalers that you use during an attack of asthma to immediately cause the widening of your bronchus or the windpipe, right? So these medications are different from controlling medications. So these are taken throughout the period. These are taken intermittently or in between two flare-ups to have a good control of asthma so that you can go on with your day-to-day life activities. Okay. So yes, inhaler plays a very, very, very huge technique because most of the asthmatic patients, we ask them to always carry an inhaler, rescue inhaler on them. So rescue inhalers, like I explained, are medications that are used to immediately cause the widening of the airways, right? So it avoids the bronchospasm. So they play a huge role. How do we use it? The best way to use an inhaler would be to keep the inhaler, to keep your mouth, on the edge of the inhaler like this, and press the inhaler. At the same time, you will be needing to take a deep breath for 3 to 5 seconds so that you can take in the medications inside. Once you have pressed and inhaled at the same time, you need to give a count of 10. Say 1, 2, 3, up to 10, and then remove the inhaler out. So you need to make sure that you use the inhaler well so that you can have a good control of asthma. If you find difficulty in using the inhaler, you do not know how to match the timing of pressing the inhaler as well as inhaling it at the same time, then always there is a spacer available. So what you can do with the spacer is that just a plastic machine like a conduit, where the inhaler is at one end and you hold, or you're wearing a mask, or you're pressing your lips against the end of this conduit. And then once you press the inhaler, you need to inhale or count for up to 10 to 15 seconds so that the complete delivery of the medicines happen. So inhaler plays a huge role in not only in controlling, not only in rescuing you, but also in controlling the asthma.
Thank you so much, ma'am. The next question for you is, how can asthma be managed on a day-to-day basis, including medication use and lifestyle changes?
Goals of asthma treatment, again, like I mentioned in the before, it involves the preventive, preventive part where you need to avoid the allergens. You need to make sure that you exercise regularly, you have a balanced diet, you sleep, have a good quality sleep, and then avoid the allergens. And the next comes the management. The management is where make sure that you have a regular follow up, and then you're taking your inhalers. Keep a rescue inhaler dose with you always, and then you have to also make sure that you are following the controlling medications or the preventing medications. And what are the different types of medications available? You have your inhaler, you have your nebulizations, that is most probably used when a patient is in extreme, in a complete asthmatic attack where he isn't even able to breathe. We definitely use the nebulizers. And the next one is the rotahela. Rotahela is where you use a capsule to deliver the medications to you. So these are the three things: the nebulizer, the inhaler, and the rotahela. And also the medications that we use are the anti-allergic medications. And then also to reduce the mucus production. So like most of your cough syrups or, tablets like Mucinex to, thicken or to loosen down the thickened mucus. And then also newer versions are available, which are the biological therapies or the immunomodulators. We use that also to have a good control over asthma.
Thank you, ma'am, for your answer. Moving on, how can individuals create an asthma action plan for emergencies and what steps can be taken if their asthma symptoms worsen?
We need to always carry the rescue inhaler with us, the inhaler which helps in widening the bronchial airway immediately. So any person who is an asthmatic, our first thing would be, even though the asthma is well controlled, is to always carry a rescue inhaler on them. Say you have an attack when you're sitting in the office space, what you need to do is immediately take the 2 puffs of the inhalers like we have explained it to you. After that, give a good space of 10 to 15 minutes and again you repeat it. So if the symptoms if improve, so if your cough is gone, your chest tightness improves, your wheezing reduces, then you can always, come down to the emergency room or, and you can follow up with your doctor saying that you had a flare up in between. Then we will be able to find out why you developed the, in between asthma. Why was there a big breakthrough, well controlled asthma? But in case the symptoms doesn't improve, say there is chest tightness and and then you are not able to breathe, and then there is bluish discoloration of your mouth, lips, face, your fingernails, and all those things. What we would do is that to also connect oxygen if it is available in the office setup. Most of the offices usually have a small clinic setup attached to them. So if oxygen treatment can be started off immediately, and then nebulizations, that would definitely help the patient come out of an asthma attack.
Thank you so much, ma'am, for answering that question. The next question is, how can individuals manage asthma effectively in work settings or during physical activities?
Very similar to what I just explained. So any point of time, use a rescue inhaler. Not improving, worsening of symptoms, visit an emergency room where we will be giving you, IV injections, nebulizations, and, oxygen therapy to support you to come out of the asthmatic attack. And you will be investigated further as to why you developed an asthmatic attack.
Thank you so much, ma'am. Moving on to our next segment, which is more on prevention and lifestyle management. So, should individuals with asthma receive flu shots or other vaccines?
Yes, this is a very, very important thing. Keeping ourselves well vaccinated against infections, against viruses or bacteria that can cause lung infection is the best way to protect ourselves from having asthma. So flu shots become very, very important to any school going kid, right? Up to the age of 10 years, all of us, it would be very ideal when the new the new flu vaccine that comes out every year, preferably it comes roughly around August, September time. So taking this flu vaccine every year becomes very, very important for school children as well as people above the age of 60 years. That is the geriatric age. Also, any person who is immunocompromised, like the diabetic, or they are on immunosuppressants, like the steroids, or who have diabetics, they need to make sure that they are taking these vaccines regularly. Other than the flu vaccine, for anyone who is immunocompromised and they're above the age of 60 years, even pneumococcal vaccine becomes very, very important to protect ourselves from worsening of any lung diseases, including asthma.
Thank you so much, ma'am, for answering that. The next question is, how often should an asthma patient visit a doctor?
That depends from person to person. If you have a well controlled asthma, we would say, 3 months to 6 months, if you can follow up, that would be good enough. But if your asthma is not well controlled, meaning to say that you're not able to carry out your day to day activities normally, and you do have flare ups, you do have occasional chest tightness, or shortness of breath, then you would have to follow up much more often. So it is a very, very individualized plan of treatment as to how often you need to visit your doctor.
Thank you so much, ma'am. Ma'am, we often see that asthmatic patients are a bit, controversial about exercising or not exercising. So, are there any specific activities or sports that individuals with asthma should avoid? Is exercise recommended for asthmatic individuals?
This is a very, very good question, because there is also an exercise induced asthma where a person, whenever they exert themselves, they immediately develop an asthmatic attack. But having said that, under a controlled environment, if you're able to, start off with exercises where, the doctor is advising you and is able to control your symptoms every time you exercise, it is very, very good. I'm pointing out to say that exercise becomes very, very important, for a patient with asthma, because they need to develop their lung capacity. Not only that, even their cardiovascular endurance improves, which is very, very much required in an asthmatic patients. So doing, having a good exercise is good, in fact, to prevent and protect yourself from asthma. Is there anything that they need to avoid? Yes, if you are a patient of exercise induced asthma, then we would definitely ask you to, take the help of your pulmonologist or your physician, so that we will be able to give you a good umbrella treatment where we can help you, or we can to bring yourself out from the exercise induced asthma.
Thank you so much, ma'am, for answering that question. The next question is, how can parents identify signs of asthma in their child that needs a consultation with a doctor?
The night coughs. This is very, very common. Most of the times when a kid is out of breath, we consider them to not be well, matured. But when a patient, or when a child is constantly coughing in the night, right? So then it is always a very, very common cue or a director towards the kid having the asthma. Next is the exercise induced, where very commonly, they start wheezing and they're not able to do activities at the level of another child. Then it is always better to get evaluated. So these are the two most common things that present. They're less commonly to have chest tightness, but nighttime cough or nocturnal cough and breathlessness is one of the most common symptoms of the pediatric asthma.
Now, on the same lines, is there any difference in the management of asthma between children and adults?
No, it is the same. The management remains the same, but the dosage of medications and what are the kind of medications that we give will be a little different. But the ideology remains same. We are going to be widening the airways. We are going to be giving anti-inflammatory, and we will be giving medications to reduce the mucus production. That remains the same. But the kind of medication and the dosages will differ. And we prefer nebulizations better than inhalers in very young kids less than 5 years of age, or we try to use spacers in a little bit older kids, because that helps them take the helps in drug delivery much better than the direct mouth to inhaler.
Thank you so much, ma'am, for answering that question. Ma'am, I also wanted to know, should individuals with asthma undergo allergy testing?
Yes, if we do find that a person, has developed allergic asthma, where they give very typical symptoms, ma'am, I develop, asthma in the period of, February, May, which is very common in Bangalore. That is the time for the pollens to come out, right? So it is the spring season in Bangalore. So whenever a person says that, or they give very clear indication that, ma'am, whenever I have seafood, that is when I do develop this, asthmatic attacks. So that is when we go in further and try to probe if the patient has allergic asthma. How do we go about it? Like I mentioned, we do the blood test called as IgE levels to find out if yes. So IgE levels helps us differentiating whether it is an allergic or non-allergic asthma. After that, once we confirm that it is an allergic asthma, then we would be asking them to go ahead with a panel of skin tests, right? So we test, there are tests that are available for, say, 8 allergens, then there is for 16 allergens, and then there is a complete panel of 64 allergens that is available. I think 64 is the highest that we have now in Bangalore. So these are the kind of tests that we will be doing. And depending on what comes out as positive, we will be asking the patient to avoid those triggering allergens.
Thank you, ma'am, for your answer on the same. My next question is, what role does a peak flow meter play in managing asthma and how it is significant?
Peak flow meter helps us to know how good our asthma is under control. So the moment the ability for us, we are not able to blow through it as we used to be able to do before, that is an indication that our asthma is not under good control or we are deteriorating. So yes, having a peak flow meter definitely is very, very helpful in knowing the control of asthma.
Thank you so much, ma'am. The last question for you is, are there any recent developments or treatments in asthma management that patients should be aware of?
Yes, now the newest medication that has come out, which is FDA approved or the WHO approved, is the albuterol and budesonide combination. That is another type of inhaler. And there has been a lot of development in the field of immunomodulators or biological therapies, where we are also giving, the newer version of immunomodulators. So yes, people can always ask for immunomodulators and doctors will be able to help them out. And this treatment is given where required. It is not for all, but where required, we will definitely be, suggesting these options to the asthmatic patients.
Thank you so much, ma'am. As we approach the conclusion of our session, we extend a sincere gratitude to each participant for their active engagement and valuable contribution throughout this event. We believe that the insights and discussions shared today have equipped you with valuable knowledge and actionable strategies. A special acknowledgement goes to our speaker, whose expertise and insights have greatly enriched this session. Your contributions have been instrumental in making this session a resounding success. As we conclude, we encourage you to stay connected with us for future events, continued discussions, and opportunities for collaboration. Thank you once again for being a part of the 2050 healthcare community. We are committed to supporting you in every step of your healing journey. Thank you.